Today we're going to be looking at a video by a YouTuber that goes by the name of Morgan Joyce. She's created a video series on tattoo removal and other topics, and she does an excellent job. In fact, I've become addicted to it. She did a video on her unfortunate tattoo allergy, and she discussed how the process worked, what her symptoms were, and what the place was that told her how to handle it and what she could do. Unfortunately, she's not a medical person, so I'm going to use her video as a skeleton video, and we're going to add some medical facts to it to really understand what is happening in her situation. It's also important to know that something that her laser place told her could be life-threatening, and we're going to get into that as well. Hi, I'm Dr. Messina. Let's look at the video.
So I have a rare and extreme allergy to tattoo removal. I didn't even know this was possible.
Tattoo allergies really are not rare. If you go in the shower and your tattoo starts to raise and itch, or on a hot, humid day, you're having a hypersensitivity reaction to that tattoo. What's rare is to have a full-blown, life-threatening anaphylactic reaction, where you lose your blood pressure and you lose the ability to breathe due to massive histamine release and swelling. Now, that's extremely rare, but it can happen. What she was experiencing was somewhere between the two extremes, where she was developing other secondary symptoms. We're going to get into that a little later.
But it's really important for me to make this video because, most of all, I hope this can help someone out there if anyone else has any of the experiences that I have.
You see, she's a pretty good person. She's using her unfortunate incident to teach others and probably save a life.
I have got laser for literally years. Multiple pieces, so many sessions with the older Pico Shore laser. And I had no problems. Like, the laser hurt, it healed, sometimes I got a little blistered, and then my life continued as normal. Tattoo removal, aside from the pain of getting it done, was an overall very easy, simple experience for me. So when I picked it back up now, I think it's been 2.5 or 3 years since I had a session, but the company that I was going to got bought out by a different company that uses a newer, more updated laser, which is the Pico Way laser. I didn't think much of this. I thought the technologies were relatively similar, just more advanced.
Okay, it's really not secondary to using a new laser. What happened was she originally got treated with a picosecond laser, the PicoSure, which was the first generation of picosecond lasers. Now, picosecond lasers have been around for decades. What's new is they made them small enough to fit in the average medical office. She had them lasered and then had a 2 to 3 year time span without any lasering. What happened is she started to develop antibodies to that tattoo ink. And then when she had the new laser, once that ink was shattered, the immune system picked up on it and she had this hypersensitivity reaction. It really doesn't matter which laser shattered the ink. It's the shattering of the ink and exposing it to the immune system, which has been primed, that's causing the problem. The immune system doesn't know if it's a Q-switch laser or a PicoSure laser or one of the later lasers. It's the ink being exposed to the immune system that caused the problem. And we're never allergic to something on the first exposure. It's always on the second exposure or later, when we have time to build up antibodies to the antigens that were released by the tattoo ink. And the fact that 3 years went in between treatments allowed plenty of time for those antibodies to build up.
I'm only talking about this time. So yeah, I documented my first session and I talked about it, and I was talking about how I had a crazy immune response. And all of these tattoos were just black, by the way. I was just incredibly itchy head to toe. I got tiny little hives on my wrists, not anything too extreme, but all of the other tattoos in my body started getting raised and itchy.
Okay, so after her first session, which was really the second session, she developed urticaria, or intense itching, all over her body. So she was already having a hypersensitivity reaction. Now, this was to black ink. Black ink is usually less allergenic than, let's say, a red ink, which is the most common culprit for a tattoo allergy.
They said that sometimes this happens with the first session.
No, it is not normal for this to happen on the first treatment.
And I've never been, treated with this laser before, so they didn't anticipate that it would continue to happen. So I gave it another shot. I went back, I did a second session, and I also did like a test of a larger piece that had some color in it too. But we decided to only do half just to see, because I had such a very intense reaction the first session. They wanted to see if I would still continue to have an intense reaction or if I would be okay.
The testing of the larger piece was extremely dangerous. She had already had systemic involvement. In other words, when people have a tattoo allergy, they often have it just around the tattoo. The tattoo might raise and the tattoo itself might become itchy. You might even see some redness around the tattoo. But when you start itching on your hands, your palms, your face, your neck, and breaking out in hives, now you're having a systemic reaction and it's much more serious. She should have not had the other tattoos lasered.
So after I did that, I just immediately after that session, I was so uncomfortable. I had to sleep with ice packs, literally like keeping a cooler in my bed with ice in it, with ice packs in it to keep rotating, because I could not sleep if I didn't have ice on it, because it was so sensitive, so itchy, and even just like my blanket rubbing up against it, any fabric of my clothes like grazing it would be just the most intense, sensitive sensory overload, like chills through my whole body situation. Then I started getting the burning palms and itchy feet again, which happened the first session. My hands got so hot, so burning, like it literally felt like hot pins and needles, itchy burning on my palms, just like this tingling burn. And then the same thing happens to the soles of my feet. And again, like all of the tattoos on my body started getting raised and itchy.
When she started to develop the burning sensation on her hands and feet, that is a very critical situation. It usually means that you're starting to have the potential to have a much more serious allergic reaction.
So remember how I mentioned during the first session I started having like little hives on my wrist? Well, after the second session, it literally took like a month for this reaction to start like happening very badly. Or I guess it started happening a few weeks later, but continued to happen for months. Hives. Itchy red hives on my neck and all along my jawline. Even sometimes like my ears getting red and itchy, and just even my face, I was getting like red just splotches all over my face.
Patients that come in and say their hands are itching, their feet are itching, their tongue feels very scratchy, are becoming very close to having that anaphylactic type of reaction. Probably the antihistamines were a good choice to start, but in all likelihood, if it happened to one of my patients, I would have started them on a Medrol dose pack, some type of an oral steroid, if not an IV steroid.
I did start taking antihistamines to help keep the symptoms at bay, and that did help, taking a Claritin or a Benadryl. It doesn't fully make everything go away, but it does help keep everything kind of like more bearable.
She says that antihistamines helped, but it didn't really resolve the problem, which is true. An antihistamine is going to help block histamine release from your mast cells. I'm going to get into that in a moment. And that should take some of the nuisance symptoms away. Might reduce the hives, the redness, and the itchiness. Now, when she had the second treatment, which would really be the third, she developed a delayed hypersensitivity. Now that could happen. Most of the time, it occurs very soon after you have the laser tattoo removal session. But it can be delayed from days to weeks, even months. And she started to develop hives all over her body. Now, if my patient called me with that, I would have probably started them on an oral steroid and maybe convinced them to do some intravenous steroids as well.
Now, to really put the icing on the cake, where I was like actually concerned for my health, was, again, this was like a little over a month after my session. I started getting, I got a lump in the back of my head, and I'm like, what is this lump, right? And it hurt when I touched it. Turns out it was just a lymph node. It's normal for your body to get swollen lymph nodes when it's fighting infection or working hard to do something in your body, right? But I've never had a swollen lymph node there. When I get sick, I'll get swollen lymph nodes like in my throat, sometimes around my period, like swollen lymph nodes in my groin area, and sometimes I've gotten them like in my armpits. I've never had this happen on the back of my head before. And then each day, more and more lymph nodes, like starting at the back of my head, going down my neck, started getting swollen to the point where I had like several swollen, painful lymph nodes, and I couldn't even turn my head.
Now she's starting to scratch her head, and she noticed the bumps on the back of her neck, the lymph nodes. Those are the posterior chain lymph nodes, and it's very different than the anterior chain lymph nodes. When we get a cold or a sore throat or any type of upper respiratory infection, it's not uncommon to have tender little nodes in the front of your neck, and they go down in a chain. Those are your anterior nodes. The nodes behind your neck usually herald a more severe disease. You have to start worrying if you have a severe infection. Do you have a malignancy? Do you have lymphoma? Now, she didn't have any of these things because we had an identifiable cause. She was scratching her head like crazy. She probably had micro-infections in the scalp because that's where those posterior nodes would drain from the back of the head down. So it did show that this was a pretty severe reaction she was having.
In laser, they call this type of thing like an extreme histamine response, but histamine is an allergy. So that's more than just like an immune response. Like to me, that's my body saying something is wrong and we don't want this. Like this is not good.
I'm going to explain what the antihistamines are. There are mast cells in our body. It's part of the immune system. And when we have an allergen stimulate our immune system, that allergen will alert our mast cells to release histamine. Now, histamine is one of those bothersome agents. It gives us the runny nose, the watering eyes, the puffy eyes that we see, let's say, with a ragweed allergy. But the histamine is actually, for our body, our friend. It vasodilates. It allows the immune cells to get into the area. That's why we see swelling, because it's vasodilated. However, histamine can also kill you. If you have a massive release of histamine, it will dilate so much that you'll drop your blood pressure and you'll get swelling, especially in the throat. That's when you start to see the anaphylactic reaction. We see it in the movies a few times where somebody's allergic to something. Next thing, they're swollen and can't breathe. It's a true emergency. It requires immediate hospitalization and treatment.
So because I only did the one half of that big piece I was talking about, it actually did make a slight change in the piece after one session with some of the shading and color. So I had to go back to do the other half because I couldn't live with it the way it was. I did take the recommendation of the laser place and load up on antihistamines like a couple of days beforehand. Day of, I took this thing called Nettle, which is supposed to be more of kind of like a natural type of antihistamine situation. The day of, I immediately iced it right after. I just did a whole bunch of things to try to make it more bearable for me this time. And even though I did still have to sleep with ice on it the first couple of days, it definitely did go better this time because I took all of those precautions. But now I'm at the phase where I'm starting to get hives and the super raised like rest of my body and stuff. So even though it's slightly more bearable this time, I'm still having pretty much all of the symptoms.
Lasering the second half of a large tattoo was extremely dangerous. That's why I'm really not a fan of medical spas that aren't physician facilities or have a physician right there. It's extremely dangerous. It could have heralded a catastrophic anaphylactic reaction, especially since she already showed that she was having significant allergic reactions.
The clinical team said that like I am safe technically to continue doing removal, but they would only be willing to do 2x2 sections.
Wrong, 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 wrong. If you have an allergy to something, you do not test it. You do not laser a small piece of the tattoo 2 inches by 2 inches. Any allergen from there can cause a massive fatal reaction. If you're allergic to peanuts, you don't take one peanut and say, well, nothing's going to happen. It's very dangerous. It was a dangerous thing for them to say, laser 2 by 2 inch areas. She already displayed severe allergic reactions. It could have been a deadly thing. Thank God she has the sense to understand her own body.
I have to listen to my body and recognize that I can't continue doing this.
She knew something was very wrong. She knew this clearly was a major problem. And thank God she opted to not touch these tattoos anymore. And according to the video, she's never going to do it again, which is good. The fact that she started to swell and itch on all of her tattoos means that her immune system has developed antibodies and is picking up antigen from all of those tattoos. So she's having a generalized response. That's why all of her tattoos swelled and all of them itched, even the ones that weren't lasered, and it's bad.
You can actually also have an allergy to the light from the laser, not just an allergy to the response or the procedure or the ink or any of that stuff. Like, you can actually be allergic to the laser. These are things I had no idea.
This is really not true. You are not allergic to the laser. The laser is just a particular wavelength of light. What you're hypersensitive to is to tissue changes that are occurring due to the laser. The first time a potential laser allergy was noted was around 2012, and somebody was having laser hair removal. And they developed hives and itching. And when they investigated it, it wasn't the laser or its wavelength. What it was substances being released from the follicles that she was hypersensitive to. So you're not allergic to the laser.
Each laser uses different power, and certain lasers target different colors and stuff like that. So this says older lasers use millisecond lasers, which is 1,000th of a second. Microsecond lasers, which is a millionth of a second. And technology that's been used widely for a long time is nanosecond lasers, which is billionths of a second and incredibly short. In spite of that, even with a billionth of a second, there's still some spillover heat. So the next generation beyond nanosecond lasers is an extraordinarily fast laser called picosecond laser, which is a trillionth of a second. So basically just how fast that light be zapping. With such short pulses, there's no time for heat to spill over to the surrounding tissue. This allows the laser technology to concentrate more energy into a shorter period of time and creates a shock wave that shatters the ink instead of spreading it. With this technological advancement, you're selectively targeting the tattoo and minimizing collateral damage around it. So these lasers are supposed to be just far more precise and far more strong.
We do have 3 types of lasers. Millisecond lasers, which are usually for hair removal and never used for tattoo removal. Q-switched lasers, which fire in nanoseconds or a billionth of a second. And then we have picosecond lasers, which fire in picoseconds or a trillionth of a second. Now, the picoseconds are putting out a lot of energy in a very short period of time. The Q-switch are doing the same. Therefore, Q-switch lasers and picosecond lasers are both photoacoustic. In other words, the wavelength of light hits the tissue, it has an acoustical sound, and it shatters the ink. Both work the same way. Both throw out minuscule amounts of heat to the tissue. Picosecond will throw out a little less heat because it's even faster. However, they often sell it and say, this is the strongest machine, this is going to be the best, it's so strong. It's strong in that it's putting out a designated dose in a very short period of time. However, it has to be altered. You see, a Q-switch laser, let's say we're doing 4 millimeters of a laser beam diameter and 3 joules, joules being laser energy. If we were going to use that on a picosecond laser, we wouldn't use 3 joules. We would use 0.3 joules. It has to be turned down. So it's really equal. It's not that you're delivering a lot more energy with a picosecond laser. It has the potential to, but the tissue would never tolerate that. You have to make an adjustment. So 3 joules on a Q-switch laser or 0.3 joules on a pico. So really, using of the pico is not really giving you a lot more laser energy.
You know, I just try to find the silver lining in all of this because this has been extremely difficult for me emotionally and physically. You know, it's hard for me to really portray how much of a physical toll this has actually taken on me. And when you're physically in so much discomfort, it does take a large mental toll. So I've really been having a hard time.
All in all, I felt terrible for this person because she seems like a very happy, honest, and sincere person. She truly wants to help people in putting out a video like this, especially showing the world her face with redness and hives. Most people hide that type of stuff. She put it out there for everyone to see in order to teach people. I felt very bad that her journey ended this way because she truly wanted those tattoos removed. Now, if they're small enough, there is the option of a surgical resection where you actually cut the tattoo out and suture the two ends together. If it's a large tattoo, it has to be done in segments. That's a potential. She's right, though. She should never, ever have laser tattoo removal again. And if you do have an allergy to your tattoos and you laser them and you do get that systemic reaction, itching all over your body, all your tattoos swelling, developing hives all over your body, swelling up of your eyes, closing down of your throat, you cannot laser them anymore. It'll become life-threatening. I hope you learned something in this video. I certainly enjoyed her video. I found them very fascinating. I'm going to put the link into it in my description. Take care, have a good day, and if you enjoyed this channel, remember, give me a thumbs up, click subscribe and the bell, and I'll catch you at the next video.